Okay, in this video I'm going to demonstrate how to perform an intramuscular gluteal injection. And again, with any injection, you want to always introduce yourself. Hi, my name is Carlos, and I'm the medical assistant. Doctor wants me to give you an injection. Is that okay? Okay. You always want to get consent because the patient may change their mind. So once we ask the patient, if we get consent, we want to identify the patient. So we're going to ask the patient to state their first and last name along with their date of birth. Once we know we have the right patient and it matches the order that we have, then we're going to check for allergies. So do you have any allergies to any medications? No. How about to alcohol, cotton, metal, or adhesive on tape? No? Okay, sounds good. I'm going to go ahead and start setting up. Alright, so the first thing we're going to do is check our label, check the medication label now for the first time. Make sure it matches the order. A lot of times these labels look like other labels. Manufacturers might make labels that look like other medications, and you don't want to make the mistake of drawing out the wrong medication. Alright, so check your label, read the instructions, and also check your expiration date. When that checks out, you're going to go ahead and prep the top of your bottle using your thumb to grind that cotton ball in there and clean very well. You want to clean the top of that. You don't know what might have settled in terms of droplets from people talking and sneezing and coughing. Okay, as that is ready to go, we're going to take our syringe and pull the back off and get rid of that top piece. Also, you're going to take your syringe now and you're going to prep the syringe by pulling the plunger all the way down. It tends to get stuck there after sitting there for weeks and weeks, and you want to loosen that. Also, you want to loosen your cap, but not take it off. So just loosen the cap. And now that's prepped and ready to go. We're going to put it back in its little sterile cradle and check now our label for a second time. Very carefully make sure that you have the right medication and that you've read the instructions and you've determined that the medication has not expired. Okay, the next thing we're going to do is we're going to begin drawing up the medication. So we're going to take the syringe, tilt it downward so the cap falls off, and then we're going to draw up 0.05 cc. So you want to pull your plunger down to the 0.05 mark, 0.05 calibration, and then you're going to put the needle in. At this point, we want to inject that air and draw the medication down. Okay. Draw it all the way down as far as you can so that you can tap those bubbles out and then return the plunger to the desired or the prescribed amount of medication. Okay, so we're back to the 0.05, bubbles are out, and we're ready to recap our syringe needle. Okay, now that it's prepped and ready to go, we're now going to check the label on the medication vial for a third time. Again, you want to make sure you have the right medication. Be careful, don't rush through this process. Read the instructions and check the expiration date. Okay, looks like we're ready to go, and we're ready to now approach the patient. Okay, man. So what I need you to do is to lie on the exam table, face down, and toes pointed inward.
Okay.
Okay. So for this injection, we're going to use the blade of our hand to palpate what's called the crest of the iliac, and that's the top, that's the bone, right, the hip bone. Okay, so find the crest of the iliac, and then you're going to actually take your thumb to split the cheek in half. And what that does is it actually places you in what's called the upper outer quadrant of the buttock. So if you don't mind, I'm going to lift your shirt up and just going to pull this down slightly, right, like that. And we're going to be giving the injection right there. Okay, so I'm going to prep the skin, small to larger circles, let it dry for 30 seconds. Once again, I'm going to take my hand and I'm going to palpate the crest of the iliac, split the cheek in half, and we're actually going to be giving the injection right there. Okay? So ma'am, you're going to fill a stick in 1, 2, 3. Go ahead and inject. Let go of the your hand placement. Aspirate, inject, and now we're going to pull the needle out. Okay? Pull the needle out, get your cotton ball, and massage, and put your tape on. Sometimes you have to, Sometimes you have to, you have to roll down the side of the pant so that it doesn't get in the way. Some offices will require that the patient have a gown on for this. And you can see in this case, the patient didn't have to take any clothing off or put a gown on. I was able to get into that upper outer quadrant by just sort of sliding the pant down at an angle. Again, making sure to maintain the modesty of the patient by not exposing them unnecessarily. Okay, that's it. Thank you.